Has Jordan Barrett ruined his face with plastic surgery? This question has sparked a lot of debates and curiosity among his fans and followers. This is a picture of him when he was young, and this is a picture after the transformation. As you can see, there have been some noticeable changes in his appearance. Many believe these changes might be due to plastic surgery, while others think it's the result of natural aging and looksmaxing. Many people say he looks like an alien after his transformation, while others think he resembles a blonde version of Richard Ramirez. In a recent poll we conducted on our community page, 80% of you believe Jordan has had plastic surgery, 8% said no, and 12% were not sure. So, did Jordan Barrett have plastic surgery or not? Jordan Barrett's entry into the world of modeling was unusual. At just 14 years old, he was caught stealing matches from a convenience store. A model scout from IMG Australia saw him and gave him a business card, starting his modeling career. This unexpected event led Jordan into high fashion, where his striking looks quickly caught attention. Jordan's unique appearance and natural charm helped him land his first cover shoot, showing off his youthful, softer features. This early success launched his career, and he soon became a sought-after face in the fashion industry. Let's take a closer look at the changes in Jordan's appearance and discuss the impact of his plastic surgery. By examining various aspects such as the shape of his cheeks, the structure of his jawline, and the overall symmetry of his face, we can speculate on the possibility of surgical enhancements. However, it is also essential to consider the role of non-surgical procedures, makeup, and natural aging in altering one's appearance. Over the years, Jordan Barrett's face has undergone a remarkable transformation. Early in his career, Jordan was known for his rounder, fuller facial structure, which some described as a bloated appearance. This softer and more youthful look is typical in younger individuals, often attributed to higher levels of subcutaneous fat and less pronounced bone structure. However, in recent years, there has been a noticeable shift in Jordan's facial features. His once round face has evolved into a more chiseled and defined appearance, showcasing sharper angles and more prominent contours. This transformation has fueled speculation about the potential use of plastic surgery. Jordan Barrett's lips have always been naturally full and proportionate to his facial structure. His earlier photos show a balanced lip contour that complements his softer facial features. When comparing recent photos, there doesn't appear to be any significant change in the volume or shape of his lips. This consistency suggests that he likely hasn't undergone lip augmentation or used fillers. His lips still maintain a natural look, indicating that any perceived differences might be due to variations in makeup, lighting, or camera angles rather than surgical intervention. Jordan's nose in his earlier photos is well proportioned, with a natural contour that fits harmoniously with his facial features. His nose appears straight and symmetrical, with a subtle bridge and tip that align well with the rest of his face. Examining recent images, there doesn't seem to be a drastic change in the structure of his nose. It has retained its natural shape and size, indicating that he likely hasn't had rhinoplasty. Any minor differences might be attributed to natural aging or makeup techniques that enhance the nose's appearance without altering its fundamental structure. When comparing photos from different stages of his career, there appears to be no significant change in the shape, size, or position of Jordan's eyes and eyebrows. They have maintained their natural form, suggesting he has not undergone any cosmetic procedures in this area. Any perceived differences in his eyes and eyebrows are likely due to variations in grooming, makeup, and lighting rather than surgical alterations. Jordan's jawline in earlier photos was softer and less defined, typical of a younger face with higher levels of subcutaneous fat. This gave him a more rounded appearance, with a chin that blended smoothly into his jawline. In more recent images, Jordan's jawline has become noticeably sharper and more angular. This transformation could be due to a combination of factors, including natural aging, weight loss, and possibly jawline contouring procedures. Some people believe that it is possible to achieve this level of sharpness through non-surgical methods such as looksmaxing, mewing, jawline exercises, and significant fat loss. These methods can indeed contribute to a more defined jawline by strengthening the jaw muscles and reducing overall facial fat. However, others argue that the dramatic sharpness seen in Jordan's jawline is unlikely to be achieved through non-surgical options alone, suggesting that surgical interventions might have been involved. Here's some potential plastic surgery Jordan may have undergone. Jawline contouring. This procedure involves reshaping the jawline to create a more defined and angular appearance. It can be achieved through surgical methods, such as bone shaving or the use of implants, to enhance the jaw's structure. Jawline fillers. This non-surgical procedure involves injecting dermal fillers along the jawline to enhance its definition and sharpness. Jawline fillers can create a more contoured and sculpted look without the need for invasive surgery. The fillers can add volume to areas that may lack definition, giving the jawline a more pronounced and angular appearance. Chin augmentation. This surgical procedure enhances the chin's prominence and definition, which can improve the overall jawline's sharpness. It typically involves implants or surgical reshaping to achieve a more balanced and defined lower face. If we compare these two pictures of Jordan Barrett from when he was young to a recent one, we can see a significant difference. He now has hollow cheeks and a sharper face, indicating a high chance that he might have undergone buccal fat removal. What is buccal fat removal? Buccal fat removal is a cosmetic procedure that involves removing the buccal fat pads in the cheeks. This procedure aims to create a more contoured and defined facial structure by reducing the fullness in the lower cheek area. It can give the face a slimmer appearance and enhance the definition of the cheekbones. By removing the buccal fat pads, the cheeks become less puffy and more sculpted, contributing to a more angular and mature facial profile. A lot of people believe that Jordan probably underwent buccal fat removal to achieve this result. Some say that his hollowed cheeks give him an alien-like appearance. However, others argue that the hollowed cheeks could be a result of his overall weight loss rather than a specific surgical procedure. Some people like this new look of Jordan's hollowed cheeks, but others say that he looks like an alien and that he has ruined his face. Hollowed cheeks have become a trend in recent years, with many celebrities opting for this look. Bella Hadid, Anya Taylor, Emily Ratajkowski, and more have all been noted for their sharply defined cheekbones. This trend aligns with current modeling beauty standards, which often favor a sculpted and angular facial structure. Over the years, Jordan Barrett has experienced a significant reduction in overall body and facial fat. Comparing photos from different stages of his career, we can observe a substantial change. Earlier images show a fuller, more puffy appearance, with a rounder face and softer features. In contrast, recent photos depict a much leaner and more defined look. This transformation is not just confined to his face but is also evident in his body, where he appears significantly skinnier. The reduction in fat has played a crucial role in altering his facial structure. Fat loss naturally leads to a more defined appearance, with sharper contours and more prominent bone structure. This change is evident in the way his facial features, such as his jawline and cheekbones, have become more pronounced over time. Jordan Barrett's facial transformation showcases significant changes in his jawline and cheeks, possibly due to procedures like buccal fat removal and natural weight loss. While his nose, lips, eyes, and eyebrows appear unchanged, the overall reduction in facial and body fat has contributed to a more defined and sculpted look. This transformation highlights the dynamic nature of beauty standards in the fashion industry and the blend of natural and cosmetic enhancements in achieving a desired appearance. And what do you think? Did Jordan Barrett undergo these plastic surgeries, or did he just lose weight? Let me know your opinion in the comments. For a full video about how facial fat can ruin your face or make you attractive, click on this video.